Welcome back to Fox 51 Today. Today we're talking about a new procedure that's really helping heart patients. It's called coronary atherectomy. Dr. Jeffrey Carr with Cardiovascular Associates of East Texas is here to explain to us how this procedure works. Good morning.
Good morning.
So tell us a little about this new procedure and what makes it so groundbreaking.
Well, this procedure involves the heart arteries in terms of taking care of the heart arteries and treating them. And normally atherosclerosis or hardening of the arteries is a soft, cholesterol-filled plaque, and it usually develops over time, and often we're able to open them up fairly easily with stents and balloons to prop it open. And the plaque is soft, it can compress behind the stent. But in many patients, the plaque turns into calcium, to almost bone. Actually, it looks like bone. And that makes it very challenging and difficult for many patients to be able to successfully perform stents. And so in those patients, it really limits options. And many patients are suffering with chest pain and are very hopeless because they don't have any good options. And so that's what this device was founded for.
How does it actually do that to kind of break through that calcification?
Well, it's a really unique design because it's basically a diamond-coated crown, and it spins at 80 to 120,000 RPMs, revolutions per minute. And so basically it would be delivered to the hardest, the bone-like plaque, and it spins at a very fast rate, and it pushes against the hard bone plaque to sand it away, and gently sand it away. And it does it at a faster rate to create a bigger opening. And yet when it comes to the more normal tissue, the tissue is able to flex away from the device, kind of like a high-speed sander. It sands off the plaque very gently, and the plaque just elutes down a stream, almost like plaque dust.
Well, that's very interesting. Now, what would you say is the ideal candidate for this type of procedure?
Well, patients that are older than 65 typically have more of the hardening. In fact, up to 40% of patients will have calcium in their arteries. So there's a large population of patients that have the hardening type of blockage. Diabetics are more prone to have the blockages of this type, and also patients with kidney disease or renal failure and people on dialysis.
So I know we were talking to break. Can this help also cloggings in arteries in the neck too? Or just about any spot in the body? Well,
actually, this device is used in the legs, and I've been using this device for over 7.5 years in the leg arteries because they can become very calcified and brittle. In the carotid arteries, which you're referring to, we use stents or surgical procedures. It's not yet approved for that indication. So it would not, at this point, it's not for the carotid arteries.
What are some signs and symptoms that we should look out for if we're having some sort of problems with our hearts?
Yeah, that's a great question. Chest discomfort is the most common in patients, where they'll have a pressure, a tightness, a heaviness is often described. Sometimes it's a burning and indigestion type pain in the chest, the neck, jaws, between the shoulder blades, sometimes down the arms. Other patients, especially with diabetics, in fact 1 out of 3 diabetics won't have those proper warning signs, so it can be very difficult and challenging, and also in women, where it's just a shortness of breath or tiredness.
What about now, with today's technology, are you able to distinguish between the sounds like softer plaque versus the calcification with imagery?
We are. We have imaging. Standard imagery is a fluoroscopic or an X-ray type of machine that we use all the time for these procedures, but sometimes that can miss it, and we have a special ultrasound device, a very miniaturized ultrasound device that can be placed inside the artery, and it very well shows us the calcium.
Well, this was awesome, very interesting information. Thank you so much for stopping by this morning, Dr. Carr.
Thank you very much for having me.
Coming up next.